Well, first of all, I'd just like to thank you for the opportunity to speak on this subject. And to let you know, I had a few things that I wanted to talk about that are outside of the realm of just self-medication. The connection between substance use and mental illness is kind of complex. We know that there are situations where substance use will cause mental illness. There are situations where people are prone to develop both conditions, and then there are situations where people are using substances to try to deal with mental illness. So we'll try to talk about all of those subjects today. That's it in a nutshell. We'll talk about the connection between these two areas. We'll talk about the treatment of these conditions, and hopefully find out a bit about how to get help for people that you care about. So we know that the overlap between these two areas is very high percentage of people. So we usually say half of the people who have mental illness have problems with substances, and approximately half of the people who have trouble with substances have a mental illness in addition to that. It's something that we're dealing with all the time in our clinical work, and a very common problem for us, because these treatment of these two things together makes the treatment of the patient much more complicated. So to begin with, we'll talk a little bit about the areas in which we believe that substance use can actually perhaps not cause a mental illness, but cause a mental illness to be present in a person, maybe earlier than we thought. So we know that when we look at people who first come to us for a diagnosis of a psychosis, that twice as many of those young people are using substances as are present in the general population. So that right away makes us suspicious that there might be a connection. We don't think that there's a direct causation, but what we do notice is that if people start to use substances very young, they're liable to develop a psychosis much earlier than they may have otherwise. And so if we look at the two groups of people who develop psychosis, the ones who are using substances are developing the psychosis much earlier, in their early teens, as opposed to late teens or 20s. And the outlook for those young people is much worse. The question has always been, which came first? Were people using substances because they were beginning to get psychotic and the substances made them feel better or helped them deal with things? So interesting enough, there was a study in 2000. The Swedish government is very obsessive about collecting statistics, and they have very good statistics on all their population. And they actually originally did this study to see if there was a connection between the height of people who are being conscripted into the army and their intelligence. And it turns out that there was a connection between the two, but they collected huge amounts of data on these young men. And so then people started saying, well, gee, this is a lot of data. We could look at all kinds of things here. And so one of the things that they looked at was whether when young people were coming into the army in Sweden, first of all, they're screened very carefully. And believe me, if they have any sign of psychosis, they are not conscripted into the army. But some of them were using substances, so we would know very clearly which was coming first. And what they found was that there was definitely a lot of people who were using substances and later developed psychosis, and it was much more common in that group, the substance-using group, much higher risk. So that was very impressive. They were 3 times as likely to develop a psychosis. So we believe that that's got to do with the fact that they were using substances early, and they also noticed that the more substances they were using, the more likely they were to get psychosis. So that's what we call a dose-related effect. It was definitely promoted by the use of the substances. Now, on the other hand, we do know that our patients will tell us that they are using substances to try to deal with some of the symptoms of a mental illness. And that could be many number of different kinds of complaints. We know that many people in the general population have trouble with depression and anxiety, and we know that they very often will turn to substances in order to deal with that. I always say to patients, I have a prejudice about this. The people that I see are people who aren't doing well. But of course, I also see a lot of people who are trying to deal with depression and anxiety by drinking alcohol or smoking pot, and it's a real trap. They may feel better for a while, but then things get worse. Yeah?
Sorry, when you're talking substances, are you including alcohol?
Yes. Oh yes, absolutely. So certainly alcohol is so commonly used, and of course has disastrous effects on the body. So definitely we are. And certainly when you talk about depression and anxiety, the drugs people are usually using for that would be alcohol and marijuana would be probably the top drugs for anxiety in Canada, I would say, sadly, because they don't work all that well. We know that people with psychosis or other illnesses who are on some medications can get quite restless with those medications, and very often they use substances like this to try to alleviate the restlessness. A particularly poignant problem is people who cannot enjoy life. The illness is taking away their sense of enjoyment or pleasure in life, which the fancy word is anhedonia, and this is a devastating symptom. Reward or pleasure is one of the reasons we get up in the morning and do what we do, and so if that is gone, it's very hard for people to be motivated or to want to go on living. And so a lot of times people will get into a trap of using substances to try to provide that reward. But again, this is a diminishing returns is what happens. And the other thing is that we see people who have terrible trouble with social situations because of anxiety or even because of psychosis, and they really have a hard time doing anything with others. And they have to get high in order to be able to tolerate that. So that's a very common thing we'll hear. And we have to remember these are people who are suffering. When you're suffering, people will do things to try to feel better. And it's pretty normal, actually, is what I tell patients. So we're not surprised to see that this is a common situation. This is a long quote that I won't read, but it's a quote from a book about actually people who were hooked on methamphetamine. And but we'll often hear a story like this, that when people first use a substance, they'll say, there was this huge thing missing from my life. It just didn't feel right. And they're always chasing that first experience where they felt right. We speculate that perhaps this is, in a way, they're identifying the fact that they've got a chemical imbalance to begin with. And that's maybe the reason we see very, very young people, 10, 11, 12. I took a history of a young man just the other day. He's really started using substances heavily at age 10, and he's been using them right along. And he's now 18, so he's got an extensive history of using all kinds. He also has hepatitis C, by the way, because he's been using intravenous drugs. And so, but he could identify that this was something that he started to use very early on to deal with the fact that he just never felt right. He had trouble coping. So what do we do when we encounter patients like this? Very often it's hard to sort out which of these conditions came first. And the reason that's important is, for example, that we notice that people will come in who are using substances and who have a lot of symptoms of depression, and they may even be under treatment for depression, but they're still smoking a lot of marijuana, or they're drinking a lot of alcohol, or they're using other drugs, and they still feel bad. And we know that many times if you will stop using these substances for 30 days or so, after 30 days about 90% of people will be free of symptoms of a mood disorder. So should we try and be dealing with that first, or should we assume there was a mood disorder and people are using substances to cope with it? Well, the things we rely on is, first of all, we ask about the family history, because we know that mood disorders and substance use disorders are very much inherited. They're very much determined by genetics and also by the way a person is raised, right? So if the whole family has had problems with substances, but we don't see a clear history of a mood disorder, we're inclined to think that's the primary problem, the substance. If we see that there's a very strong family history of mood disorder and people that had shock treatment and are on lithium or in St. Thomas, then we suspect it's primarily a mood disorder. And of course, you can have both too. It's quite possible. We also look for people like this young man I described to you for early use. So if people start using substances very early, that's usually a sign that that was the primary problem. They started with the substances. If they give a history of being able to use large amounts of substances and tolerate them, that's usually a clue that they have genetic predisposition for substance abuse. And oftentimes they just grew up in a home where this was quite normal. Everybody in the family had difficulty. Everybody was using substances. They were encouraging the kids to use them, and that's sadly often the case. And so once they start to use, then they develop a physiological drive to keep using them, and they sort of learn to cope. in this way. So if you see that kind of a pattern, you suspect that that's the primary problem. So, as I mentioned, unfortunately, you can produce symptoms of mental illness strictly from having a substance abuse disorder. So it's very common to develop depression. One of the ones we see quite often that's very difficult to treat is young people who start to use a lot of ecstasy. Ecstasy is a drug that releases a lot of the transmitters in the brain. There's a huge release of these transmitters, and then the brain takes a while to reaccumulate the transmitters. And so you are quite depressed. And if you do that for a good length of time, you can really put the brain into I don't know what you'd call it. You overdraw at the bank. You just can't get those chemicals back for a long time, and that takes a while to recover. Use of substances greatly increases the chance of making a suicide attempt. The rates of people who commit suicide who are actually using substances at the time are very high. Sometimes as high as 80%, it looks like, certainly making attempts. That lowers your resistance. You become more emotional, you're more impulsive, and you're more likely to try to hurt yourself. And then we commonly see people who become used to using these substances to deal with anxiety, and when the substance wears off, they get tremendous anxiety, rebound anxiety, and panic attacks. So I remember learning in school that people who wake up at night with panic attacks, you should always think of substance abuse, because this is a withdrawal phenomenon. And even you can get psychotic symptoms from using substances. Sort of classically, we think of alcohol, so probably everyone has maybe heard of that, situation where a person starts to have, see pink elephants, they say, and this kind of thing. So they actually develop psychotic symptoms from alcohol damage to the brain. And that can be permanent in some cases. Another interaction between these two illnesses is this interaction with medication. Now, it's interesting because patients will often say to me, so if I decide to have a drink, right, then I can't take this medicine, right? So they've all learned somewhere or other that you shouldn't do this. But unfortunately, what I find is that they then say, well, I'm going to have a drink, so then I don't take my medication, which actually isn't what I would have told them. But sometimes this becomes an excuse. A patient told me the other day, she wasn't going to have treatment because it would interfere with her lifestyle, which I think was, maybe a good deal of the problem. The other thing we sometimes forget is that if your alcohol or street drugs are drugs, and they can interact with medications, and most commonly, they can raise your tolerance for medications, or your requirement for medications, we'll say. One that we sometimes forget about is cigarettes. So cigarette smoking actually causes your liver to make more enzymes. And as a result, you have to take higher doses of some medications. And that can cause more side effects. So you have to take more medicines to get the positive effect, but on the other hand, you get more side effects. Then we'll see people who will stop smoking, and they suddenly get tons of side effects because they were used to having to take a high dose. The other one I'd like to mention is Champex. So interestingly enough, I think if you see those ads on TV, you'll see that it warns about depression. The people who took Champex in the trials, actually, they had more people whose depression went away on Champex than actually had problems with depression. But the other thing that happens when you go on Champex is you stop smoking. And that changes a lot of your brain chemistry. And stopping smoking, even without Champex, can cause people to become depressed. So there's a very complex interaction there. And of course, the other thing we know is that there's huge medical complications to using drugs and alcohol. Alcohol is probably the worst of all these drugs. It's very destructive to every organ in the body. And then, of course, we all know about IV drugs, and like this young man I told you about who has hepatitis C at age 18, very damaging to the liver. And then there are numerous medical complications of almost all of these substances. The other thing is that, as I mentioned earlier, if you can convince people to stop using drugs or alcohol for about a month, you'll find that many times the symptoms disappear. So a common problem will be people are not always entirely honest about how much alcohol they're drinking or what street drugs that they're using, and they come in presenting with depression, and they say, I've tried this medicine and that medicine, it's nothing working, and you're trying different medicines, and you're increasing the dose, and you're adding other things. And, maybe eventually they're going to admit to you that they're using alcohol or drugs. And so then you have to try to convince them, you know, listen, we're not getting anywhere. Maybe we should really give this a try to, you know, see what would happen if you come off these medicines, and just try it for a month and see what happens. And that can be a hard sell for people. I mean, after all, they've learned to rely on those drugs as a way to cope with life and with their symptoms. And to convince them to not do anything and try to stick it out for a month, that's hard. But sometimes that's what we have to do.